which is a complex and interesting chapter on autism and the research that we know thus far. Recently, the terminology for autism has changed with the Diagnostic and Statistical Manual of Mental Disorders. Autism is really a puzzling and intriguing mental health concern, and we're looking at it as a neurobehavioral syndrome. That's a big idea. You know, in the past we used to blame mothers, thinking that it was a problem in parenting and you have been a terrible mom and that's why your child is not, communicating properly or showing attachment. Until recently, the prognosis for children with autism was very, very poor, and individuals may not have had independent living as an adult. But here's the really great news. With the research and improving, treatment and early intervention, we're seeing much better futures for children with autism and much more hope with more independent living. This is a class of disorders that is identified in early development, and it's characterized by significantly impaired behavior in many areas of development. Now, the important word here is spectrum, because the symptoms are vary hugely in severity. And so, you might know someone with autism that has the same diagnosis as someone else, but they look very different. So mild versus severe, and then what kinds of symptoms are they showing? In the past, we used to think this was some kind of psychosis, but we know that that is not true. I'm going to give you the recent changes with the diagnostic criteria in the DSM-5 in these slides. It varies a little bit from your book because your book was published right when those new criteria were coming out. In 1990, autism was added under the IDEA law, so you can see that it wasn't that long ago. We view this as a developmental disorder, and it mainly impacts communication and social interaction. And we generally see symptoms before the age of 3. And now we're seeing in research studies that we can really look at brain information in really small infants, but those are just generally in the research settings. Autism does impact education, and so we need to adapt how we provide information to these individuals. Now, as I mentioned, your textbook has the old definition of autism spectrum disorder on page 273. I would like you to disregard that information and use the information I'm giving you on the slides because it is the most current information from the DSM-5. The characteristics of autism are many, but here are the major categories. First of all, the person has impaired social interaction, and they have difficulty in communication. Now I'm going to give you a few ideas, but it's certainly not, inclusive here. They fail to initiate a conversation. They fail to take joy in someone else's joy, or they may have difficulty understanding something from your point of view. They have a hard time, perhaps, understanding the subtleties of relationships and the nuances of making a friend. Things like sharing, taking turns, all of those things, may need to be taught to all children, but then for a child with autism there might need to be specifics and constant repetition and practice on those things. Children and individuals with autism have a great deal of difficulty understanding the subtleties of nonverbal language. Maybe a raised eyebrow to you means, I have a question. Or a surprised face with big eyes and a big mouth. You immediately know they're surprised. A person with autism has difficulty understanding that. And remember, much of our language is nonverbal. The individual may have a delay in spoken language. In other words, their first words might not be till ages 4, 5, or 6. Maybe they, speak in a complete sentence even after that, but maybe not. They may have the lack ability to sustain a conversation, maybe a yes or a no or a grunt or a nod, but then they don't continue to ask more information. They also may have restricted behaviors or interests. Maybe maybe their movements are stereotyped. In other words, they do the same thing over and over again, like rocking or tapping their arm or something like that. They may use an object unusually. Instead of playing with the whole truck, they only play with the wheels. Or maybe their speech is stereotyped. They echo the same information. A person with autism really likes to have things the same. We all like routines and rituals. Maybe you have a morning routine for getting ready for school, and that's comforting. Maybe you help your child with a bedtime routine. That's a really good thing. But if you have to change your routine, you're able to do that. Here, the individual may just have a complete meltdown, have great difficulty switching, may have difficult time, even like changing a meal or sitting at a different seat at the table, or if you rearrange the furniture in the living room, that might cause great difficulty. So in here, the routine or ritual becomes restrictive. The range of interest may be very small. The person has a deep interest in one or two things. Perhaps it's trains, and they know every kind of train there is. Maybe they're only interested in a particular sport, perhaps. They also may show a difference in reactivity to the environment. In other words, they might be hypersensitive, oversensitive to things, or undersensitive, hyporeactive. Hyperreactive might be that they can't stand touch, so maybe combing their hair might be extremely painful even, just the feeling of a comb. Or perhaps they're underreactive, so they don't sense things like heat or cold the way you would. These symptoms are present in the early developmental period, in other words, before the age of 18, but sometimes we don't see them until the society demands, we need to use these skill sets. Or if you learn certain skills, you can, mask these things until they come out later in life. These things cause great impairment in social interactions, in the workplace, and other areas of functioning. And we can't explain it by anything else. It's not due to intellectual disability or other kinds of developmental delays. There are other specifiers with autism, and so I just want you to be aware that there might be some other things going on, like maybe they're having trouble with, they have an intellectual disability along with autism, or maybe they have some other medical concerns. I just want to let you know I'm giving you a broad definition here, but certainly we can make it more specific with the diagnosis. And we also need to look at how severe the autism is on the spectrum. And if you notice, I'm taking information from the DSM-5, and if you happen to have one, it is on page 52 of that book. But maybe you need a little bit of support. That might be level 1, all the way to level 3, meaning that you have to have substantial support for all of your daily living. Now, the prevalence data that I have on this slide is already dated. It's 2011. Here we are. It's now, the prevalence rate is 1 in 66 children, so it's jumped from 1 in 110 to 1 in 66. That is phenomenal. And that's why our book actually, in this edition, adopted a special chapter for autism, just to give it the credit that we need to study this more. It is the fastest growing category in special education, and boys are 4 times more likely than girls to develop autism. Girls may also, when they have autism, have accompanying intellectual disability. Well, what causes autism? That is the million-dollar question. The answer is we don't know. We want to know, and we want you to be aware of the really great research that's going on here. There are a lot of myths about the causes of autism, and I have given you some good websites on your Blackboard site to look at the research critically, and if you have questions, you can go there to the legitimate websites. We do know that we think that there is some kind of biological link. We see, more concordance in identical twins, but it's not 100%. We think that maybe there is some abnormal brain development. We are seeing some differences in the structure of the brain and how the brain develops, and also some neurochemistry in the way the brain processes information. This is fascinating, and a lot of the research is going on right here at this level, looking at how we process information. Also, genetically, there may be some other things going on in the environment. Maybe is this some kind of later infection process? Is it some kind of environmental toxins? What's going on, and why is this rate of autism going up? These are all the questions that we are trying to find out. So how do we help? That's a huge question, and I do want you to know that we are trying to look for the most effective treatments for children with autism. It's going to be an eclectic approach because one size does not fit all, and so it's going to be custom tailored to that child. What I can tell you is we want to begin early. The earlier the better, and we want to give intensive services. These are behaviorally based services, and what we want to do is focus on communication and social skills. If the problems are there, then how do we remediate? So let's teach this child like what happens next in a social situation. Maybe we do that through stories. Maybe we do picture activity schedules. If the child cannot communicate verbally, we can give them pictures and they can communicate through pictures, or maybe even having pictures on an iPad, or iPad, and so that they can look at those kinds of opportunities to successfully participate and to communicate. These activity schedules also help students learn social skills, and so what do we do next, and how do you basically look at photographs or stories to go from one step to another so that they can engage in positive behaviors. If you look in your book, you'll see some pictures of these multimedia activity schedules and what those look like. I also have some really neat videos on the Blackboard site that show you the use of iPads and how that can help with communication. Now, there are some individuals that might need medications, maybe for sleep or for obsessive types of behavior or aggression, but medication is not the first line choice of treatment. It may be used as part of the treatment